The negative effects of sleep disorders have been studied and talked about at length recently. Two new studies seem to show a link between obstructive sleep apnea and cancer. My guest is Dr. Roger Briggs with Briggs Family and Cosmetic Dentistry in Scottsdale, Arizona. Dr. Briggs, welcome. Let's just talk about exactly what sleep apnea is.
Well, sleep apnea is the term means without sleep, apnea. So when one's asleep at night, for one reason or another, the airway gets closed up for, by definition, 10 seconds or longer. And when that airway gets closed up, oxygen level drops down and creates a lot of hazards for your health.
So there were two studies here that talked about a link between sleep apnea and cancer.
There are two studies that have come out recently. One of them was done at the University of Wisconsin in Madison, and another one was done in Spain. Both of these studies found that there was a link between the severity of sleep apnea and your percentage of risk of dying of cancer.
Dr. Briggs, can you elaborate a little bit on the overall negative health effects of sleep apnea or sleep disorders?
Well, the sleep apnea, Scott, that affects our entire health. From the dangers that we pose to ourselves and others driving a car. It creates a sleepiness that you just can't overcome, all the way over to pregnancies. It can affect the growth of the fetus, and simple things. We find that when we treat our patients for sleep apnea, they suddenly don't have that acid reflux anymore. So it has affected us in so many ways we don't even realize it. Amazingly enough, it also affects children. I see children that are 6, 7 years old, and we can look in their mouth and see how they've been grinding their teeth. It creates a great deal of stress for children when they can't get an air opening. And we look a little further, and sure enough, there's some great big tonsils back there, or their jaws are underdeveloped. And all these things create a narrow airway so that we start breathing through a straw instead of something the size of a garden hose.
So in these studies, there doesn't appear to be a cause and effect. Can you talk about how these studies link cancer and sleep apnea?
Yeah, it's interesting because it really is a valid study. The study that they did, for instance, in Spain, I think they had over 5,000 subjects that they studied. These were people that already had a death certificate, and they went back and related their cause of death to the degree of sleep apnea that they had. And what they found was people with real severe sleep apnea, that's having 30 or more apneas per hour, those people had a 5.8 or 4.8 increased risk of dying from cancer than the average person. So there was a definite link. If you had moderate, I think it was down to 2 point something, and if you had mild, it was down around 10%. Or 1 times greater of dying of cancer. So these definitely have a link. The studies done at Wisconsin, they had, I think, over 2,500 subjects that they studied, and all of them had a lot of good scientific validity to their studies.
And Dr. Briggs, finally, if someone suspects they might have a sleep disorder, what's the first step?
Well, first of all, confirm it. People over 65, about 10% of the people over 65 are walking around with undiagnosed sleep apnea. The average person that you see out there in the supermarket line or at the movie theater line, 4% of them have undiagnosed obstructive sleep apnea. You don't have to be overweight to have it. You don't have to snore to have it. Those are all things that can contribute to it. But the first thing is to really get a confirmed diagnosis with a sleep test.
All right, Dr. Briggs, thank you.
As always, it's a pleasure.
Once again, my guest has been Dr. Roger Briggs with Briggs Family and Cosmetic Dentistry in Scottsdale, Arizona. This is the Dentist News Network.